Good evening. My name is David Oni. I'm a psychiatric mental health provider, and I just want to really talk to us briefly about what is one of the most common mental illness. It's called depression. I just want to talk to us briefly on how do you identify symptoms of depression? How do you know whether you are depressed or not? Or how will you be able to identify whether a friend is going through depression or not? There are things that you will see that will change, that will make you kind of think that, maybe there's depression. Over a period of 2 weeks, it might be that you are going through depression. Number one, sleep. When you sleep too much, or you don't sleep at all, or when your sleep becomes problematic, it might be a leading sign that there is depression. Now, there are so many things that could happen that could make your sleep to be problematic, but when you see too much sleep or less sleep, that is one of the major symptoms of depression. Secondly, we talk about the mood. You know, when somebody is depressed, their mood is just down, very, very down. They lose interest in what is interesting, what was formerly interesting to them. They don't have interest in pleasurable activities. They become very irritable very quickly. Little things get to them. They are very, very angry within a very short time. Another symptoms you might see is that they might start having negative emotions, like feeling helpless, feeling hopeless, and feeling just hopeless, worthless sometimes, that the world is not a good place to live. So if you notice any of these things, it's time to come out. There's nothing to be ashamed of about this. Another thing you could notice is your energy. How is your energy level? In people with depression, they have low energy, they feel fatigued, they feel very tired most of the time. And you will see that they are just tired, actually. You just get tired. And another thing you will see are symptoms of depression, which is your concentration and your focus. Your ability to focus diminished. You get easily distracted. You can't think very clearly. You can't make clear decisions. Could be a symptoms of depression. You might need to start thinking of seeing a mental health professional. Another thing you might see changes in is your appetite. In people with depression, you either eat too much or you don't eat at all. You either eat too much or you eat too little. So if you notice a distortion in your appetite, in your ability to be able to eat, it could be one of the symptoms of depression. Then in some people, you just see that generally your activities is just low, your body movement is just down, and you don't really know what to do. If you notice any of these things, I will encourage you, I will recommend you to see a therapist, or to see a psychiatrist, or to see a psychiatric and mental health nurse practitioner. It is very, very important when you have these issues, you are not able to sleep well, loss of interest, low energy, you are not able to focus, loss of appetite or eating too much, changes in your weight, whether weight gain or weight loss, and then maybe you are having suicidal thoughts. It's very, very important that you see your mental health professionals so they are able to assess you and they are able to set realistic goals to help you. It takes a lot of work to get out of depression, but there's no shame. There's no shame. Go out there, look for help. Once again, my name is Dr. David Oni. I'm the Behavioral Health Director of Oasis Behavioral Health in Richland, Washington. I will be coming on to talk about your mental health and you every week. And if you have questions, feel free to drop a comment or a questions about your mental health if you want to know anything. Thank you very much. I talk to you again next week. Bye for now.